Minutes.
Well, thank you, Madam Speaker, and I too want to commend the Republicans and Democrats who worked very, very hard to get this legislation to the floor and hopefully to the President's desk as soon as we can, particularly Chairman Pitts and Ranking Member Pallone, Leonard Lance, Anna Eshoo has been Lois Capps, and the staff, really, on both sides. I made a commitment to all these members early on that we would work very diligently to get this legislation here, and we are finally here. Madam Speaker, this bill, S-1440, known as the PREEMIE Reauthorization Act, is designed to strengthen health care for kids, particularly vulnerable kids. Not only does the bill reauthorize the PREEMIE Act, it also includes the reauthorization of the Children's Hospital Graduate Medical Education Program, and it authorized the National Pediatric Research Network. You know, the original PREEMIE Act that I sponsored brought attention to the problems related to preterm birth. And since its passage, the preterm birth rate has declined. Good news. But despite that improvement, according to the CDC, still 500,000 babies are born prematurely every year in this country. That's 1 out of 8. We can and we must do better. This reauthorization will continue and strengthen the ongoing effort to track, prevent, and treat prematurity, ensuring that every child has a healthy start and a better chance at a healthy and productive future. Madam Speaker, the National Pediatric Research Network brings us a step closer to providing more help to the kids with unmet health needs, particularly those with rare pediatric and genetic diseases. I've met a number of times with a family in my district, the Kennedys, whose wonderful little daughters, Brielle and Brooke, who are affectionately known in our office as Sleeping Beauty and Cinderella, they have a rare disease called spinal muscular atrophy. And it's often difficult to conduct research into these diseases due to the very small number of kids with that disease. But today, we're working to provide families like the Kennedys and so many others with greater hope for a cure or advancement in the treatment. This bill will help establish pediatric research networks and the consortia that are effective in overcoming gaps in research. Networks and consortia will be comprised of leading institutions that act as partners to consolidate and coordinate those research efforts. With the passage of the Children's Hospital Graduate Medical Education in 1999, freestanding children's hospitals began receiving funds. 30 additional seconds? Freestanding children's hospitals began receiving funds to support their pediatric medical residency programs. And as a result, the number of pediatricians in the U.S. has grown steadily. Today, over 40% of the pediatricians and pediatric specialists are trained in the 57 freestanding children's hospitals that receive this funding. Proven track record, we need to get it done. And again, I congratulate the members on the floor today for getting this bill hopefully to the President's desk before the year is out. Yield back the balance.
Gentleman's time has expired. Gentleman.